Today we're going to talk about the most dangerous medical emergencies.
Okay.
And so I have a list of 10 things that would be considered medical emergencies, and I didn't include trauma. So like, there's nothing in here like I got shot or I stabbed myself in the neck with a ice pick or whatever. Like these are medical emergencies.
Did it to yourself.
Well, whatever. These are medical emergencies. So like, non-traumatic type things.
Yes.
And so I made a list of top 10 things that are considered to be, pretty dangerous events. And so, I don't know, do you guys want me to quiz you or do you just want me to talk about it? What do you guys feel like doing today?
Can we guess?
Yeah, sure.
And then you can tell us if it's on there, like what it's ranked at.
You want to guess some?
Yeah.
That'd be fun. Well, yeah, okay, so, all right, so what do you think are some, Sarah?
Heart attack.
That is on
Cardiac
there, that's definitely
arrest or
on there.
whatever.
Do you think that one's really, so I rank these these top 10 from least deadly to most deadly. And of course, even the least deadly is still dangerous. So you think heart attacks?
I think it's up there.
Huh?
I think it's up there.
It is on the list. I wouldn't say it's at the very top.
Oh,
So-
6.
Huh?
Is it number 6?
No.
Oh.
I have these in reverse order because I obviously didn't think about this because I have number 1 being the least. So I have it. This is my number 3. What else do you think's on there? That's good. You're absolutely right.
Stroke.
Yeah, good. Man, nailed it. That's 2 of the 10.
Yeah, I mean that's
I
cardiovascular.
bet if you sat here,
issues.
you could probably get over half of these. Got another
Anything
guess?
else with your brain, like an aneurysm or something?
So normally aneurysms would result in stroke.
Yeah.
That's because it'll be a bleed. Yeah, but you're right. Yeah, that's right. So
I don't know.
you're
I
doing
feel
great.
like
I mean, hey, I'm proud of you. I mean, like a lot of people.
Because I'm trying not to think about things that are like trauma that can
Right.
just
Yeah, I
happen
didn't
in
include
your
like
body.
car crash or like my parachute didn't open or whatever. Like these are like more medical.
Some type of an obstruction.
Yeah. Perfect. Bowel perforation. Yeah, good. Man, you're killing it. All right, so I'm going to roll into these. All right, so on the list here at number 10, I have anaphylaxis. So you guys familiar with anaphylaxis?
I've heard of it. I think I remember what it is.
So anaphylaxis is basically the worst type of allergic reaction that you can
Yeah.
have.
Like when your throat closes or something.
That's exactly right. Yep,
Yeah,
that's one of the
I've
things.
heard of
Your
that.
airway can shut off. And so
have an EpiPen.
the one thing about anaphylaxis you have to remember is that you have to have a second exposure to the event. So for example, if you were to have an anaphylaxis reaction to like a bee sting, you'd have to be stung by a bee first. Your body then creates these protectors against bee stings. What happens is when that thing re-happens to you again, your body overreacts. And that's how that you get into trouble with this. And so actually, to be honest, I didn't remember like what the risk of death for anaphylaxis was. I know it's not insignificant, but it's not super high. So the risk of death from anaphylaxis is 1 to 2%. So if you have an anaphylactic reaction, there's a 1 to 2% chance that you're going to die. And the other thing that I looked at with these dangerous medical emergencies is how common are they, right?
Yeah.
So how many people go into anaphylaxis every year? And so for anaphylaxis, it ranges from 50 to 100,000 people per year in the United States that have an anaphylactic reaction. So that accounts for about 1,000 deaths a year from anaphylaxis.
I think it happened to me when I was a kid.
From what? Like
Fire ants, like anything that has a sting. My sisters put me outside to play, and
So you live in Texas, but you're deadly allergic to fire ants?
I was when I was a kid.
Oh, but you're not anymore?
No.
Okay, that's
So
good.
my mom used to have to carry an EpiPen around.
Really?
Like I was allergic
Yeah.
to. They found out I was allergic to like fire ants, like any type of
Stinging
bug that like
insect.
had like some type of venom in it.
Yeah.
Yeah.
Dude, fire ants are the worst. I hate fire ants so much.
Yeah.
I remember when I played football. I grew up here playing football in Texas, and the fire ants would like make mounds on the field, and you get tackled into like a mound of fire ants, and like people be on top of you, like, no, the fire ants are getting me.
Well, and you don't feel them till it's too late.
Oh, right, yeah. So next on the list is one that you hear about a lot, and that's pneumonia.
Yeah.
So you guys are familiar with pneumonia, right?
Yes.
Mm-hmm. Yeah, absolutely.
So there's a few different types of pneumonia. There's bacterial, and then there's like viral pneumonias. And of course, the bacterial tend to be the worst. COVID pneumonia, that would be a viral one. Typically, that's not as dangerous. So pneumonia is definitely a little bit more dangerous. The risk of death from that overall is about 5%. Now, of course, there are certain people who are more at risk. That would be, elderly people or really young people. But the thing is that there are a ton of pneumonia cases every year. There's about 1 million cases of pneumonia every year. So you're looking at about 50,000 deaths per year from pneumonia. Next on the list is yours. So this is number 8, I guess, heart attack.
Okay.
So lots of heart attacks every year, a little less than pneumonia. There's about 800,000 people that have heart attacks every year. Of those, I think 600,000 are first heart attacks, 200,000 are repeat heart attacks. And the risk of death from that, about 12%.
Yeah.
So that's actually a little lower than I thought. I would have guessed it would be around 20%, maybe, just kind of ballparking it. You know, I mean, that means roughly it's like a 1 in 9 chance of dying from a heart attack. So, you know, that's good. It means if you have a heart attack, there's definitely a high chance that you could survive it. So next is one that I always heard about this when we were talking about going to college, and that's meningitis. You guys familiar with meningitis?
Yes.
So meningitis is basically an inflammation of the brain or spinal cord membranes, and most of the time that's due to an infection. And once again, like pneumonia, it can be from bacteria or viral, and the bacteria is much more dangerous. So risk from death of bacterial meningitis is 15 to 20%. Pretty high. Viral is a little bit lower, 1 to 10%. Now the good thing about meningitis is it's pretty rare.
Yeah.
So although it can be very, very dangerous or deadly, there's only about 500.
Isn't there like a vaccine for viral?
There is, yeah. Yeah, look, God, you should just go to med school.
I would have a health degree.
Oh, that's right, I forgot. I forgot. You wear so many hats, I forget. Yeah, very good.
I took a lot of classes to go to PA school, but I never went.
Yeah, no, it's never too late. So there's about 500 to 1,000 cases of meningitis every year. All right, next, the one that you named, stroke. So stroke is very common as well. There's 800,000 stroke episodes every year. So
yeah.
Pretty big number. As I was mentioned earlier, there are 2 types of stroke. There's clots, so occlusive stroke, meaning a blood vessel gets blocked by a blood clot. And then there's bleeds, which is the one that you were kind of alluding to with an aneurysm or a abnormal blood vessel that ruptures. Now, the risk of death of stroke is there's two measurements. Most people measure, what's the risk of death in the immediate time frame, so like in the first few weeks, and then what's the risk of death in a year? So risk of death in the immediate time frame is 12%, but if you extrapolate that out to a year, it's about 25%. So strokes are pretty dangerous. Definitely something that you want to keep track of your cholesterol, which also that goes along with heart attacks, which, by the way, I just had my blood tested because I had to get some life insurance, and my cholesterol's good.
Good.
I'm getting older, so, you know, you can't just assume it's going to be good.
Yeah, high blood pressure and
that's right.
All of that runs in my family.
Oh, really?
Yeah.
You need to stay on top of it then.
Yeah.
So strokes are, number 6. So number 5, aortic dissection. So you guys have heard of the aorta? Okay, so the aorta is the major blood vessel that comes out of your heart. And so a dissection is when the blood flow gets into the walls of the blood vessel. Okay. So it's not flowing through, like imagine like a garden hose, and if we get into like the layers that make the wall of the hose, then the water, or in this case blood, is not flowing where it should be. And what happens is when that blood flow gets into the wall, it can actually occlude the whole artery. Yeah. So these are very, and you know who died of this was, who's the guy from Three's Company, Jack Tripper? What's his real name? Jack Tripper.
I know who you're talking about. I think we talked about this one time.
I think we did. Anyway, Jack Tripper, I hate that I can't remember his name. I'll remember it in a minute. He died of aortic dissection. Yeah. That's really bugging me. I can't remember his name.
Just watch the other video. I'm pretty sure we talked about it last week. Yeah. I swear we did.
Oh my God. I'll come to it.
John Ritter.
Yeah.
Ritter, that's right. Thank you, Travis. Thank you. I was like flailing. I was like, Travis, help.
I was trying to figure it out myself.
Thanks, dude.
John Ritter.
Thanks, man.
Got you.
So yeah, John Ritter died of aortic dissection. So if you have an aortic dissection, your risk of death is 30%. It's pretty high.
It sounds very serious.
It does sound right. Your blood vessels are suddenly not flowing in the right direction.
Your major artery.
So fortunately, there's not a ton of aortic dissections every year, about 10,000. So you're looking around 3,000 deaths. Number 4, bowel perforation. So you were kind of talking about that. We were talking about obstruction, which can lead to bowel perforations. Other thing that can lead to bowel perforations are things like ulcers. Like if you get a bad ulcer, like in your stomach, or if you get diverticulitis.
Somebody was found out that was why they died.
Lisa Marie Presley.
Yeah.
You were exactly right. She had a bowel obstruction.
Yeah.
And I assume that she perforated. I saw that. We're on top of things. Like
I know.
We're very news. We know a lot about the news. We should be proud of ourselves.
We know things.
We know things on this show.
Hey, actually, also too, one of the viewers actually chimed in and said it. Timberline. I know I probably killed that name, but they talk about Lisa Marie Presley.
Yeah.
So they just had actually mentioned it.
That's exactly right. I saw that. They just came out that I actually had forgotten that she died. I when I saw it, I was like, oh yeah, I forgot she died. And then, of course,
they just announced like what she died.
And I hate to say this, anytime that a celebrity dies, I'm always like, it was a drug overdose, which is terrible. And I just, I know that she'd had some issues in the past, so I just kind of thought that. But yeah, she died of bowel perforation. And further, the reason she had a bowel obstruction was she'd had weight loss surgery. And so when you have intra-abdominal surgeries, it increases the risk that you have a bowel obstruction down the road.
What is the obstruction?
So what happens is when you go into the abdomen and you start doing work, when you leave, like scar tissue forms. And so instead of everything being kind of free and mobile in there, you get these bands of scar, and the intestines will like loop over them, almost like a garden hose looping over on itself and making a kink.
Oh.
And then that makes the obstruction, and then if it's not relieved, it can rupture. Or the bowel can even die. You can get necrotic bowel or intestines, so that's really bad. So bowel perforation.
Painful.
Thank you. And who is that person, Travis? Somebody we know?
So his name is Timber Bannon, I think is how you pronounce it.
Okay. Well, thank you so much for chiming in. Thank you so much for chiming in there, Tim. So bowel, yeah, I like to say thank you for chiming in. Risk of bowel perforation death, 30%.
Yeah.
Yeah, pretty high. And there's actually a fair number of bowel perforations in the United States every year, around 50,000. So you're talking
Can you get a bowel obstruction from like after you have a C-section if they don't put your stuff back in correctly?
You could. I mean, it's less likely because you're down so low, right? And so on a C-section, the incision's very low, and basically the first thing that you see when you enter into the abdominal cavity is the uterus. So you're not really getting into like all the intestines as much as if you're doing something like a weight loss surgery.
Okay.
So there's not a lot of.
I was just thinking about that because I remember my daughter's dad telling me that they were just like pulling stuff out of me. And I was like, what?
It's very graphic. Like, okay, yeah. No, I mean, typically when you're doing a C-section, I've actually done a few C-sections back forever ago. You open up the bottom, like this uterus is right there, you get the baby out, but then, you're getting clot and stuff out, and I mean, that's probably more with,
what
placental
he was
stuff.
probably seeing.
Placenta, is what they're pulling out, not necessarily your intestines. So, but that's good. I like that. It's very graphic. Thank you. Okay, so moving on to the top 3 now. All right, so these are the top 3 most dangerous medical emergencies. Septic shock. So sepsis is a infection that gets in your blood, and I did go specifically for septic shock. So the difference in sepsis and septic shock. So sepsis is when you get a blood infection. Septic shock is when it's bad enough that it starts to affect your other body organs.
Yeah, so something starts shutting down.
Things start shutting down. So the risk of death from septic shock is 35%. So we're getting up there. And the total number of patients that have any type of shock in the United States, huge number, 1.7 million people, and roughly there's about 270,000 deaths.
I wonder if that's like an age thing or like a...
For sure. Like older you get, the more risky it is. Yeah, absolutely. I mean, the younger you are, the healthier you are, the more likely you're going to bounce back from one of these, bad things. So, okay, number 2 is cardiac arrest. Okay. So your heart stops beating. And that could be from a lot of things. One of the most common reasons that people's heart stops beating is they get into like a malignant rhythm, like some sort of, like the way the heart beats gets irregular and it causes them to go into cardiac arrest. It could be from like a blow to the chest. There was that football player whose name I'll never remember that
yes.
Travis, you probably know, about sports.
It was Lamar Hamlin, I believe.
That's right, yeah. He took a blow to the chest, caused cardiac arrest. It could be from things like a heart attack, so there's a little bit of overlap here. But cardiac arrest is really bad. If your heart stops, you're in big trouble, even if you get treatment. Risk of death, 75%.
That's what happened to my dad.
Your dad died of cardiac arrest?
Mm-hmm. Like 4 years ago.
Oh my gosh, I didn't know that. I'm so sorry.
No, it's cool.
Sorry to hear that.
It's like very rampant in my family. His brother died of a cardiac arrest as well.
You got to make sure you go see a cardiologist and get on top of that. I'm going to make you go to the doctor.
I have my blood pressure's always been high.
You have got to go to the doctor, Sarah. You can't be like dying here on stage.
I promise I won't.
Give medical care or something. Okay, so number of cardiac arrests annually, 350 to 400,000. So that's a pretty big number. Yeah. Okay, number 1, most dangerous, most deadly medical emergency. Anyone have any idea?
Asthma attack.
No, that's not a bad guess. No, that's not on there. It would be hard for you guys to get this. This is kind of an obscure one. So it's a rupture of a aortic aneurysm.
So another aorta.
Another aorta thing. So what that means is, as that giant blood vessel goes down, if it gets plaque buildup, it becomes a weak spot. And just like if you air a tire up too much, and have you ever seen a tire get like this kind of bulge on it?
Maybe like
a bike tire.
Yeah, a bike one. Yeah.
Yeah. Okay. So that would be a aneurysm if it was on a blood vessel, and so that makes a weak spot. And this is your major blood vessel, and if that thing ruptures, you are in trouble. So risk of death from an aortic aneurysm rupture is 80%.
I wonder how that happens. Is that just like poor health or
It's
genetic?
usually related to cholesterol buildup.
Okay.
You get cholesterols in your blood vessels, and then that makes a weak spot. And then if you have high blood pressure as well, it causes that area to kind of bulge out, you know? So almost like if you have a tire that has a defect and you air it up too much, because like think of putting too much air as high blood pressure, then it goes and it makes a thing. And if you keep going, it pops. And when these pop, it's extremely deadly. So fortunately, it's not super common. It's not common as like a stroke or heart attack. There's about 20,000 episodes of this per year, but that means about 16,000 people die. So those are the top 10 most dangerous medical emergencies, of which I want to have 0 of these in my lifetime, I'm hoping.
2 of them run in my family. Or heart attack, cardiac arrest, and stroke.
I'm going to make you go to the doctor.
I've been to the doctor.
All right, good. Would you tell them all these things?
Yeah.
All right, good. Well, it's important. You know, got it. I'm the worst. I've actually started going to the doctor more often.
Well, girls, I feel like it's more, girls go to the doctor, I think, more than boys
And girls
do.
are much more responsible than guys.
Yeah.
Yeah.
'Cause
Travis,
girls
you
go-
go to the doctor?
I do.
Oh, good. All right, good. Very good.
You go to get
I
like
do.
your annual exam
Yeah.
and all that stuff.
Yeah, I don't ever do that. I'm bad, but I'm getting better.
Yeah, telling me to go to the doctor.
I know, right? Doctor, heal thyself. Okay, let me know what you think about those medical emergencies. If I missed one or you want to hear about a different one, leave a comment and we'll talk about it. So,